Hi, I'm Lauren Muhlheim, and I want to let you know about my book, which is now available for pre-order. And my book is When Your Teen Has an Eating Disorder: Practical Strategies to Help Your Teen Recover from Anorexia, Bulimia, and Binge Eating. And the subtitle is called Practical Strategies because the book is meant to be a easily accessible and implementable strategy for parents who are helping their teens with eating disorders recover at home. So I thought it would be helpful to share some information similar to what I cover in the book that is relevant to this time of year. Since it's a time of year when students are going back to school, one of the things a lot of families are thinking about is how to handle school lunches. So the book is based on the principles of family-based treatment, which is a treatment that involves the parents in helping the adolescents to restore regular patterns of nutrition and to restore weight if that is a goal of treatment. So in family-based treatment, parents are usually involved in supervising all meals at the beginning of treatment. And we usually tell families that if you don't see your child early in recovery eating it, you should assume it has not been eaten. So the question for families with kids going back to school is how to handle school lunches. And that's one of the subjects that I cover in the book. I actually have a section with different options and ideas based on how other families have handled it. So one of the questions is ways to handle school lunch. Probably the way the most families I have worked with have handled this is by having the parents go to school and the teen comes out and eats lunch with the parents in the car. This has many advantages in that the parent gets to directly supervise, the teen gets to come out in a discreet way and not be seen with the parent at lunchtime, and usually there's an incentive to get back to school pretty quickly, so meals will go rather smoothly. Other strategies involve sometimes having someone else at the school supervise, sometimes a favorite teacher, sometimes a school nurse, sometimes a staff person will be available to supervise lunches, sometimes privately in an office. Sometimes more remote supervision is possible, whereby someone can check in, throughout the meal and see that the adolescent is actually eating. Sometimes students will just go to school for half the day, either until lunch and then come home for lunch, or sometimes they'll only go to school in the afternoon after lunch. Sometimes some students will come home for lunch and maybe a class period and then go back to school. There are many creative ways of handling this, and I think the main things to keep in mind are that there's no one right way to do this. Use your creativity, see what works with your family. I'm always amazed by the creativity that the families I'm working with come up with in solving these problems. And the other thing to keep in mind is that this is just for a time. It's not forever, so you will not be supervising your child's lunches forever, I promise that. This is a phase, and over time you will be working on handing back more control to your teen. So think about what will work for now, and then you'll modify as recovery progresses. So I hope this tip has been helpful, and I hope you'll check out my book. It's available now at Amazon and also on my website, eatingdisordertherapyla.com. And I wish you a wonderful and smooth back to school season.